Good morning, everyone. Welcome to our webinar today on the topic of situation with vulnerable migrants and refugees in Europe and South America in the context of COVID-19 outbreak. My name is Maria Shishova. I'll be your host today. I'm an intern at the Center for Law and Transformation and research assistant at the Sociological Institute at UIB. Um, We are hosting this seminar today together with Center for Law and Social Transformation, together with Bergen Global. We're really happy to welcome everyone to participate in our discussion by leaving the comments in the Q&A box in Zoom. And going to our topic now. So as you all know, the outbreak and the quick spread of COVID-19 has shocked the world. Many countries have responded with strict measures that limit people's movement within and across borders. While in some European countries the pandemic is under control and the strict lockdown measures are slowly being lifted, the coronavirus is spreading like wildfire as we speak in South America, a region with more than 3 million Venezuelan migrants and refugees living in different countries. In this seminar, we intend to discuss, on the one hand, the situation of the vulnerable migrants and refugees in Europe, and on the other hand, we will talk about how strict measures taken by South American countries to control the pandemic are deeply affecting Venezuelan migrants and refugees. To do so, we've assembled an amazing panel for you today. To begin with, I'll start with our first panelist, a well-known person in Bergen, Christina Jakobsen, a director of the Center for Women and Gender Research at the University of UIB, and a professor of social anthropology, working mostly with the topic of gender studies and international migration and ethnic relations. Currently, Christina is involved in two big projects. One of them is Waiting for the Uncertain Future, the Temporalities of Irregular Migration. And the second project, Protect, the Right to International Protection, a pendulum between globalization and nativization. Welcome, Christina.
Thank you very much, Maria, and thank you for the invitation to be here.
Thank you for coming. Thank you for joining us. Now I'll introduce the second panelist, Pierina Benavente. She is a master student in global health at UIB. She focuses mostly on the topic of development of inclusive health policies for migrants and refugees. And she's my colleague as well. She's an intern on law and transformation. So welcome, Pierina. We're really happy to have you as well.
Thank you. I'm very glad to participate today. Thanks.
And we can start our discussion slowly diving into the topic. First of all, I think it will be logical for our audience to understand the situation in both France and in Peru. That will be the main countries we'll be discussing today. Starting from a small introduction of pre-epidemic and the current situation with the vulnerable migrants and refugees, so in France and Peru. And why is this topic so important to talk about, especially now? So I believe we can start with Christina first.
Yes, thank you for that, Maria. So let me first stress that the situation of refugees and migrants in Europe was already very difficult before the pandemic outbreak. What we have seen, though, is that the pandemic and the measures put in place to combat it exacerbates and illuminates structural inequalities and situations of precarity. So I will speak mainly of the situation of migrants with a precarious legal status, including undocumented migrants and those who are in an asylum procedure. And I will speak mainly about France and more particularly Marseille, where I was following up on my fieldwork among migrants with a precarious legal status at the time of the pandemic outbreak. Since I relocated to Bergen, I have been following the developments as best I can from here. But of course, as an ethnographer, it is necessarily a limited view to see things as they develop from here and not on the ground in Marseille. So when it comes to borders, as Maria already mentioned, the pandemic led to a close down of national borders, and possibilities to travel across such borders were severely reduced, also for those who under normal circumstances enjoy the privilege of international mobility. We need to remember, though, that European borders have for long been blocked to non-EU migrants, and that crossing for many has happened at the risk of death. The pandemic has aggravated the risk of border crossing, as migrants have been pushed back, denied entry, and detained, notably in the Mediterranean region, with reference to the health emergency. So the COVID situation has not only led to the closure and policing of external borders, it has also reshaped and reinforced borders inside Europe. On the one hand, the reaction to the pandemic reinforced the distinction between citizens and non-citizens by nation states calling back their citizens and facilitating their return. On the other hand, the outbreak has also led to calls for a more inclusive attitude towards temporary residents, including calls for the regularization of undocumented migrants in Europe. And the arguments that we see now for regularization, they mainly move along two lines. So on the one hand, it is the need to secure a labor force in the agricultural and other exposed sectors that largely depend on cheap migrant labor force. On the other hand, it is public health concerns and sometimes also humanitarian concerns related to the fact that refugees and undocumented migrants in many countries are excluded from healthcare and welfare arrangements. So European countries have responded differently to these challenges. The Portuguese case has been hailed as an example by many migrant rights activists. They exceptionally decided to grant temporary legal status and the same rights as Portuguese residents, including the right to work and to healthcare, to all those who had demanded a residency status before March 18, including asylum seekers. But this is a temporary regularization, and migrants will need to renew their application for residency once the crisis is deemed over this summer. France chose a somewhat more restrictive line, extending for 90 days the validity of all residency permits expiring during the pandemic emergency, including provisional statuses and those having registered as asylum seekers. But unlike Portugal, France did not extend the same rights as the ones that citizens have to those with a precarious legal status. So they remain excluded from the labor market and dependent on special provisions that exist on the side of the general health and welfare services to a large extent. So I think it's important to note that temporary regularization doesn't really solve the situation also of those undocumented migrants who are not in any regularization process. So these temporary regularizations are for people who have already applied previous to the epidemic outbreak for regularization. And also for those who are temporarily and precariously regularized, it puts their situation on pause, extending the uncertain weight in which they find themselves rather than really resolving their situation on a more permanent and long-term basis. And a prolongation of the waiting situation is also a consequence of the pandemic for many asylum seekers, as it has made it more difficult both to register an asylum application and to have one's application processed. So in France, many public offices and NGOs that are crucial to the asylum process closed down due to the strict confinement measures in place from mid-March. And as you all know, people were not allowed to leave their homes for more than an hour a day in France, and only for particular recognized reasons. So such office closure and appointment rescheduling translated into delayed procedures and prolonged uncertainty for asylum seekers. While asylum demands were still being processed to some extent, many parts of the process, including appeal processes, were slowed down or put entirely on hold. And in Marseille, where I work, there has been, and there still is, considerable confusion among the actors in the field about which parts of the asylum system are functioning and what does the suspension of certain functions entail. And there have been activists in France, in particular in the Paris region, petitioning the State Council and claiming that practices during lockdown have been in violation of the principles of the right to international protection. They're now slowly opening up again throughout the country. So I think that what is interesting is that the pandemic has illuminated a central idea precisely in the WAIT project that I work on, namely that bordering practices are as much temporal as they are spatial. So managing borders under the pandemic has been a lot about extending deadlines, prolonging expiring residence permits, suspending deportation processes, etc. So it also reveals the extent to which the government of migration in contemporary Europe depends on a system of temporariness, of not granting permanent residency to most migrants and refugees, but operating through different forms of short and temporary permissions to stay. A crucial question has also been in relation to various deadlines of the asylum process. Should time passed during the health emergency and confinement period count for all those procedures that have a particular timeline? You know, you have 6 months under the Dublin Convention to expose someone towards the country responsible for their asylum application. Is this time running during the emergency and the confinement, or should one start counting again when the crisis is over? So those are different kinds of temporal questions and questions about temporal bordering that have been raised during this pandemic situation. Now, when it comes to the living situation of migrants with a precarious legal status, there has been quite a lot of focus on refugee camps as spaces in which pandemic outbreaks will have disastrous consequences due to overcrowding and poor sanitary conditions. But it's not only migrants in camps that live under poor conditions. In Marseille, where I do my ethnographic fieldwork, access to housing is very difficult for asylum seekers and undocumented migrants, including for isolated minors. And many live either on the street, in squats or overcrowded apartments, or in informal camps. So the advices for physical distancing and good hygiene are very difficult, if not impossible, to follow under such living conditions. So in France, during the crisis, special centers for sheltering COVID patients without housing who didn't require hospitalization have been created throughout the country, admitting people regardless of their legal status or of their health insurance coverage. And authorities have also declared their intention to provide housing for all in need during the confinement, starting with those deemed most vulnerable. But local NGOs in Marseille report that despite these good intentions, many have been left without shelter during the pandemic and thus without possibilities of self-isolation and confinement. And confinement measures have additionally exposed those who live on the streets and do not have a home to isolate in to the risk of being policed and fined for violating confinement regulations that have been quite strict in France. So in France, as I mentioned, the confinement rules required a pre-filed attestation of the reason for one's movement, which meant also considerable increased policing of public space. On April 23rd, the Interior Minister announced the success of confinement measures by referring to the some 15.5 million police controls effectuated and the 915,000 verbal processes initiated that showed the success of the confinement. And according to French sociologist Jérémy Gauthier, there are strong indications that such controls, as well as some episodes of police brutality and racism, were disproportionately directed at racialized populations in poor neighborhoods. So for undocumented migrants, policing of public space also increases detainability. And precisely detention centers have been at the heart of debates throughout Europe in this period. Migrants held in centers in which sanitary conditions were already critical before the pandemic outbreak have protested and demanded to be released. Some governments have been releasing detainees, but no general decisions to close down detention centers have been taken in France, despite the health risk that they represent. However, judges have repeatedly decided to release detainees on a case-by-case basis, since detaining people awaiting deportation is not justified as long as borders are closed and deportations mostly suspended. However, while there has been much less deportations the last period, France continued, in fact, to effectuate them towards a number of countries, including some Dublin transfers to other European countries, despite the health emergency and the very high rate of contagion in France at a previous point. So let me briefly mention also the access to medical services in this period of emergency. Maria, please stop me when my time is up. I think worth mentioning is that undocumented migrants and asylum seekers have poorer access to medical services than residents in most European countries. This varies very much from country to country, but in many countries, including in France and Norway that I know best, many undocumented migrants depend on NGO-run health clinics for medical care. And in many places, this offer has either been entirely closed down or only partially continued during confinement and lockdown. Despite authorities implementing a number of measures to adapt the right and access to health to the situation, NGOs nevertheless have reported massive challenges in securing access to healthcare for undocumented migrants and asylum seekers during the pandemic. And I think beyond the question of rights to healthcare in different countries and their varying implementation in terms of access, it is also a question of trust. Some undocumented migrants avoid seeking healthcare for fear of being detected. The pandemic has also increased the surveillance side of the health system as measures for tracking down connections and preventing transmission of the virus are being rolled out. Such surveillance may increase undocumented migrants' susceptibility to being detained and deported and may prevent them from seeking out the medical health care that is needed. When it comes to the economic situation, and we see that more and more now, how there is an attendant economic crisis to the health emergency situation. And as we know, European countries and the EU have put in place several important measures to compensate for the devastating effects of the pandemic on people's economy. However, these measures mostly exclude those who work in the informal economy, which is the case for many asylum seekers and undocumented migrants who don't have a working permit. So also work previously available in the informal economy has disappeared as society was shutting down, and losing income opportunities has increased economic hardship for undocumented migrants. A range of associations and activists have organized as best they can to provide food and necessities for those most affected, but distributing it without too much sanitary risk and without breaking confinement rules have been challenging. And in Marseille, the lack of possibilities to secure an income during confinement happened alongside a pre-pandemic bureaucratic failure to provide economic support to a number of asylum seekers who had their allocation stopped by a mistake. So sort of this bureaucratic mistake put people in a situation where they where their allocation as asylum seeker was stopped at the same time as they were losing the possibility to have an income from work in the informal economy, which created a very difficult situation for many of the migrants, and not only for the migrants themselves, but also for the families and networks that depend on them in countries where they have traveled from.
Thank you, Christina. That was really informative. Lots of information to consider for us as well. Now we can actually switch to Pierina to find out what's the situation like in Peru and maybe in other South American countries that are neighboring Peru.
Yes.
Can you start basically answering the same question? Why is this topic so important, especially for South America now? And what is the situation? What's the situation with the vulnerable migrants and refugees before the pandemic, and how it has changed now as we speak?
Perfect. Thank you. Can you hear me well?
Yes.
So I would like to start giving a general picture of the Venezuelan migration and refugee crisis. And the UN Refugee Agency estimates that around 5 million Venezuelans have left their country, and more than 3 million of them went to South American countries, and mostly Colombia and Peru. Peru is the second country with Venezuelan migrants and refugees in the world. Early this year, it was estimated that there were 860,000 Venezuelans in Peru, and most of them arrived in the last 2.5 years. And to give some perspective here, the Peruvian population is 32 million. So this was an acute migration, and Peru, as many other countries in South America, was not ready to receive this huge amount of people. So the government was still working on integrating them. And it was at this point when this COVID-19 pandemic came. So it was already an emergency situation, and this made it worse. And the pandemic now in South America is increasing. And according to the WHO, right now, South America is the new epicenter. Peru has around 130,000 cases. They have the second highest contagion rate after Brazil. And Peru has this high rate despite they took early drastic measures in mid-March. It was one of the first country in the region to close its borders and to have mandatory isolation. So everyone has been in mandatory isolation at their houses since March 16. And last Friday, it had been extended until June 30. So it's a long period of lockdown. And so, but 2 days ago, last Monday, the country has started opening some business. So economic has just starting to reactivate. But we don't know at this point how this is going to work. And regarding to Venezuelan migrants and refugees and their incomes, before COVID-19, it was estimated that 93% of Venezuelans were working in the formal sector, 93%. And this number is expected to increase post-pandemic. Now they cannot work, and most of them depend on daily income. So it's getting very hard paying rents, buying foods, and other basic needs. And every week, this increases, and there are more migrants needing help. In March, it was estimated that 250,000 Venezuelans were in position of extreme vulnerability. And now this number may have doubled, may have tripled, and they all required urgent assistance. And the Peruvian government is providing economic support to vulnerable residents during the pandemic. But Venezuelans do not have access to it, as they are not residents. Most of them have legal status in the country, and this situation is very similar in all the countries in South America. So they have legal status. They have a special permit to stay and work. And they have also claimed for asylum. Like half of them have claimed for asylum. In fact, Peru is the country with the highest Venezuelan asylum seekers in the world. It's more than 450,000 asylum claims. But they are no residents, so they do not receive this economic help. And also there are undocumented migrants, and we don't know the exact number of this group in Peru. But here the government requested the UN to get international funds to help Venezuelans in the country. But there are some challenges with international donations now that all countries are in crisis. And even before the pandemic, the Venezuelan migration and refugee crisis was the most underfunded. At this point, different international agencies, NGOs, churches are providing money, food, and other basic needs. There are also, of course, hotlines working 24 hours a day in case the migrants need help or advice. Pretty much now is to provide emergency assistance. And all agencies are trying to coordinate their activities and to share information to avoid overlapping here. And also now with the pandemic, they are even more vulnerable to labor exploitation and xenophobia. And labor exploitation and xenophobia were also a big problem for Venezuelans, of course, before COVID. And this is just getting worse now. And when it comes to housing, most of Venezuelans live in shared rooms or crowded shelters. We don't have camps, it's crowded shelters or rooms. And most of them do not sign contracts for those. And with the pandemic, several are facing evictions as they are unable to pay the rents. There were some surveys performed to Venezuelans last April, and around 50% reported being in risk of being evicted, 16% in high risk. But for sure, this only has increased since April. And basically also in regard to housing, they depend on the help they can receive from UN and the other international agencies, Venezuelan Embassy in Peru, NGOs. So they try to look for shelters. They also, of course, improve sanitation services in the shelters, provide psychological support. Also, UN is providing monetary help in some cases that can be destinated to pay rent. And also, very interesting, the Venezuelan Embassy is providing legal advice to deal with the eviction situation because it's against the law, kind of, at this moment. So they're trying to help it, and according to the Venezuelan ambassador in Peru, they have prevented around 650 evictions so far. But there are some migrants already living in the streets. There are not many shelters available, and this is getting more and more difficult. And I told you, the mandatory isolation will end in June 30, so it's one more month here. And many migrants and refugees are desperate at this point and considering returning to Venezuela. According to the Immigration Office's figures, 31,000 Venezuelans left Peru between mid-March and mid-May. And in Colombia, in the same period of time, I think that the estimate number is twice as big. And also the Venezuelan ambassador mentioned that they have identified now, at this moment, like 10 groups that are walking from Lima, the capital, to the borders. Sleeping on the streets. They're very exposed, very vulnerable. There was a case in the news a couple of weeks ago, a very tragic accident with a walking group of Venezuelans that were sleeping next to a highway. So it's a very urgent to do something now. When it comes to healthcare services, by 2018, 91% of Venezuelan migrants did not have any type of health insurance in Peru. So the percentage have been reduced a little bit by this year. We don't have the exact number, but We know that maternal and child healthcare and some vertical, specific vertical programs are accessible for Venezuelans, but for other health services, they will need health insurance. But in Peru, you cannot enroll into the public health insurance scheme if you are not a resident. And again, most Venezuelans are not resident. During the pandemic, the government is providing free services for COVID detection, diagnosis, and treatment to every person in Peru. Uninsured Venezuelan migrants or refugees can be temporarily enrolled into the public health insurance scheme if they have tested positive or are suspected to have COVID-19. But this crisis has highlighted all the flaws in our, like in the Peruvian health system, and that is very fragmented, very segmented. And there is an urgent need to reform and to integrate everything in order to respond in a very efficient way to the health needs really of the entire population, not only migrants. But now, as many countries, the system in Peru is collapsing, so the access for everyone is a problem. But some positive news here is the progress in incorporating Venezuelan migrants and refugees with professional health training into the Peruvian health system. And here the government issued a national decree in April in order to hire foreign health workers during the crisis. And there are around 4,000 Venezuelan doctors in Peru. And before the pandemic, there was an NGO that was working on helping them to validate medical degrees and to help them taking the examination board so they can start like certifying. And I think they send all these names. Yes, they send all these names to the government with the contacts, with the information of these Venezuelan doctors, and they're calling them and they are hiring them to work in Lima, and the region, also different regions that are more affected by the pandemic in Peru. They have started hiring them, and so far there are not more than 100 working, but it is expected that many physicians and nurses will be integrated into the Peruvian health system in the following weeks. Now, in regards to the immigration services, all asylum applications and other services at immigration offices were suspended for several weeks, as in all countries. But the government made it clear that no one could be expelled or deported from the country during this time. Neither they will be affected by their permit expiration, so they will not have to pay any penalty fees. Now it is possible to access some of the services in the webpage, but it's mostly permit renewals. So they have this special permit to stay in Peru, they can renew that by in the web. And this is important because a significant amount of Venezuelans reported that their permit expire. And so they could be afraid of looking for assistance during the pandemic, for example, because of these expirations, right? And so it's now to finalize, I would like to say that Peru has experienced a sustainable growth of economy in the last 25 years. And this helped to have really one of the biggest economic planning in Latin America to mitigate the impact of the COVID crisis. And so everyone expects that the economy reactivation has been designed very carefully. And the government is considering also the informal jobs, and because it's not only a problem for migrants, it's also a national problem, as 72% of the economically active Peruvian population are working in the informal sector. And as I mentioned before, there are around 93% of the Venezuelan refugees that are also in the informal sector, and that's before COVID. So really Peru opened its doors to Venezuelans, and the government is very receptive to talk. This is a very difficult time, and they need to reconsider and balance priorities, of course. The government knows that this crisis makes the migrants and refugees even more vulnerable. but they have not put this group in front in the national agenda now. And we hope that they can incorporate them into the national welfare programs in the near future.
Thank you, Pierina. That was really also really informative. We can see some parallels between the cases, although we're kind of talking about two different continents. Now, we will be proceeding into the discussion and the question parts of our seminar or webinar. That is why I want to motivate our audience to actively participate and ask their questions in the Q&A box, as I said, in Zoom. I'm basically constantly monitoring it and expecting some questions from you guys. While we're waiting for the questions, we can discuss some issues that were mentioned already and to summarize some information that was discussed. So my question is, to both of you, we can start with Christina as well. First, what are the main weaknesses that you think COVID-19 has explicitly shown? You've mentioned several, but if you can just explicitly say it in several phrases, just to summarize all the information that you already discussed.
Yes, thank you. I think one major weakness that has been exposed is the inability to provide global responses to a global crisis. And this, of course, is also characterized responses to the previous so-called refugee crisis, which has tended to bring the concern with the nation state and safeguarding its borders and citizens to the fore at the cost of more global perspectives. And in Europe, we know that there has been considerable debates around questions of what the EU lingo calls burden sharing, or how to involve more countries than the first reception countries in actually receiving migrants and asylum seekers. So I think that just like the migration question more generally, the pandemic faces us with an important choice between nationalist isolation and global solidarity, to put it a bit sort of in broad terms. And I think that the COVID pandemic has also made visible even more than before the dangers of internal bordering practices, not only the external or geographical borders, but also the many ways in which parts of populations are excluded from economic, social, and medical protection. So in the case of migrants, as I have described here, with precarious legal status, I think that the pandemic condition has added a new layer of anxious insecurity. But because of the closing of the borders, as states stopped registering and processing asylum claims, as they proposed hearings, as they closed down volunteer-run healthcare centers, and implemented mobility controls and checkpoints also within cities, so also increasing the internal borders and undocumented migrants' exposure, both to economic vulnerability, but also to detainability, and finally the threat of deportation.
Thank you, Christina. Now, basically, the same question is referred to Pierina.
Okay, yes, well, many weaknesses. And I can see it in two different levels. I don't know, national and global. In Peru, in the national level, I can mention the inequality in the country, and in general in all countries in Latin America. That is the most unequal region in the world, and this makes the mandatory isolation at home even more difficult, and that the contagion rates higher in poor areas, and also the public system all the public systems are weak, and it is hard to see as Peruvian that Peru could have started changing and considerably improving these systems 20 or 15 years ago when our economy started to grow, and they didn't do it. So if our systems do not work for our own population, it will be even more difficult to integrate migrants or refugees in the country. So that's a big problem. And also in the global perspective, and as Christine mentioned, is kind of one of the weaknesses, the lack of international funding, so global funding. And it was very, very hard for me to see the lack of international funding for the Venezuelan refugee crisis in general. And as I mentioned before, COVID-19, the Venezuela crisis was already considered the most underfunded in the modern history. And despite being the second biggest refugee crisis in the world after Syria, and the UN projection before COVID was that it will surpass the Syria's crisis by the end of 2020. So still, it had been extremely hard to get funds if you compare it to other refugee crises in the world. So I was very impressed by that. And but I should mention that something that happened yesterday, the European Union with the UN Refugee Agency and the International Organization also for Migration, they organized a conference to raise money from donors. So for Venezuelan migrants and refugees in the Latin American countries, because of this crisis is in the news, of course, in the world, around the world. And it seems an important amount of money was collected yesterday, but we will see how this will use, right? Still, there are not funds in the Latin American countries to help them. So that's, for me, that's very, very, that's the weakness I can say.
Yeah, thank you again, Pierina. Now we have the first question from the audience, from Ruth Hanstveit. This can be a difficult question for both of you, I believe, because it's really specific to intensive healthcare units. I don't know how much information you both have, but the question is, how situation about the access to intensive healthcare units for migrants and vulnerable refugees groups, both in France and in Peru, if it's needed?
Okay.
Just if you have any information that you can deliver to us, we can start again with Christina if she has anything to say, and then we will jump to Pierina.
Yes, sure. So France is actually one of the countries in Europe who who's on the side of granting more access to healthcare than many other European countries to undocumented migrants. So there is access to emergency healthcare for undocumented migrants in France, which there is also in a majority, I believe, of European countries, the access to emergency healthcare in terms of saving lives. There is also in France a special provision for access to healthcare for people who are outside of the main health insurance system, and which is located in Marseille, where I work, in the two major hospitals in the city, which is more sort of accessible and which helps undocumented migrants to access healthcare rights. But there are a number of barriers to such access. You need an enormous amount of documentation, so various kinds of papers, and you also need to have been present already in France for at least 3 months and pay a fee to access it. But for emergency healthcare, it is accessible. But there are, of course, even if the right exists, there are practical barriers that I talked about, of different kinds of policing of public space, of being afraid of seeking out healthcare for fear of being detained, and So in practice, a lot of people depend on the healthcare provided by voluntary associations, like, for instance, the Doctors of the World, who have health clinics around France, particularly for undocumented migrants. I do not have any knowledge of how this has been played out during the COVID crisis. I know that the healthcare centers for undocumented migrants, or the accessibility centers in the hospitals, have been trying to offer at least the possibility of testing, COVID testing, and making sure that that is available also to people outside of the regular health system. But I also know that several of the clinics run by Doctors of the World, for instance, have been forced to close down or to minimize their activities during the emergency.
Thank you, Christina. Now we can go to Pierina. If you can just give us like a short answer, maybe in 2-3 minutes, because now we have lots of questions coming in. So I want to squeeze as much as possible since we have around 14 minutes left.
Yeah, yes, of course. Well, Peru, before the pandemic, Peru had 500 intensive care units in the country, in the whole country. So we are 32 millions and we have 500. And then they start, like, I think that the first week when the pandemic started in Peru, the first thing was to increase this number. So right now there are 1,000 beds in the whole country, and they're trying to duplicate this, to have 2,000 by the end of June. So they're working on improving all the health system at this point. And they have done good things, but of course there were a lot of flaws before that. So it's now has collapsed. So really Venezuelan has the same rights than Peruvians to access the intensive care units for COVID right now. But they are all having problems. So they will face problems. It doesn't care where you come from, because the system is collapsed, right? So I'm not sure if yeah, that was a question, right?
Yeah, it was the question. Right. Now we will switch to, again, as I said, we have 4 questions, incoming questions. They are pretty big. So I think we have a nice discussion now. They last 12 minutes. So the first question will be, is directed, personally to Professor Jakobsen, so Christina Jakobsen. It's a question from, sorry if I'm pronouncing it wrong, Associate Professor of History, Pai Dong Sun. The question is, yes, what do you think of the most important impact of COVID-19 pandemic on the academic refugees, given the sequence of the job market? What are the gendered influences on women scholars?
Thank you for that question. I do not work in particular with academic migrants or migrants who work in the academia. So these are questions that I have not really researched or have any good answers to. I guess that there will be some general dynamics where the labor market will possibly become tighter in a number of places as a consequence, even tighter, as a consequence of the economic crisis onset by the pandemic, and that may make it even harder for migrant academics to find jobs but beyond that and the gendered consequences, we will have to leave that for some other time.
We can also write the answers if you have extended answer afterwards to those people who ask the questions, if you want to. Now, the question for both of you. Actually, it's also, maybe it's a good idea to start with Pierina, because it's what she mentioned in her introductory speech about too much attention given to some particular groups of refugees and lots of humanitarian help going to particular groups of refugees. So now the question is, in Norway, the refugee camp Moria in Greece have gotten a huge amount of attention, and the campaign Save Children from Moria now have got viral in Norway. It's a big political issue for Norwegian government. Do you think it's problematic that a single refugee camp gets so much attention and media focus when refugees camps all over the world are affected by COVID-19? And many refugees and migrants don't even live in physical camps. What do you think is the reason that one camp get all the attention? So, as I said, we can start with Pierina first. What your ideas on it?
Why can one get all the attention? I really don't know. That is, it's kind of the media works, right? And at this point, I think the most important thing at this moment is to give the information about what is happening around the world for me, and of course sometimes it gets some of the cases get more published, or they got more news, and there are more yes, it's more over there, and it's I think it should be, I don't know, it should be, I will go for try to, I don't know, try to give more information about what is happening in general. So, and that's our responsibility as researchers. That's the responsibility for everyone. For example, in Peru, in my country, they are working, and I'm so glad that in the last 2 weeks, I saw many news about the Venezuela situation in South America. And I think now with this founding conference that was yesterday, is up to the eyes of everyone. And I think that thing is like a little small work, and it's a step by step, and we need to reach to everyone. And I don't know, and it is because we didn't reach everyone before, that it was the most underfunded crisis. So at this point, of course, there will be cases that it will be in the news more than others, but it is up to us to put also the others in the table, right?
Thank you, Pierina. Now we'll shift to Christina. If you have anything to say about it.
Sorry. Maybe just to add that I think this is illustrating the way in which how we think about migration and refugees has largely become part of a humanitarian logic, what in the literature is referred to as humanitarian reason, and many have written critically about this particular logic, how it works by appealing to affect and to emotions of pity, rather than thinking about this through notions of right and politics, right? So I think that this is very important to see now, that the humanitarian logic works precisely through creating objects of pity and objects that we can mobilize around. Now, I mean, I don't think that makes it bad that there is particular attention around individual cases or cases like the Moria camp. I think they're necessary within that particular logic in order to raise awareness about these questions. But of course, that shouldn't prevent us from thinking about how we can transform the very representational logic around migration and refugees issues. And I think that is important.
Thank you, both of you. Now we have 5 minutes left of our webinar, so I'm really sorry, but it will be the last question. So let's say we're really quick answers around 2 minutes each. The question is, how should the international community go forward from here to enable better protection of vulnerable population? And what sort of collective reaction and solutions are necessary at this point? Again, we can start quickly with Pierina, so around 2 minutes, and then we switch to Christina.
So can you repeat the last part of the question? Sorry. It was.
Yes, basically, the idea is what should we do? How should we move forward? And how should the international community
Yes.
enable better protection for vulnerable population?
I think it's very difficult. It's very difficult for international community to get together, to understand and to prioritize, to balance all the efforts. And I think at this point, they need to prioritize what is more urgent. So we are in this emergency, we are on this crisis, and they need to evaluate, they need to get together, they need to work together. It should be an integration of efforts, and they need to discuss very carefully, put the things on the table, check how to distribute the money. And I think I hope more than I think that they will get good fundings. That's also what I heard from some UN representative, that it has been hard to get fundings, but they are getting those. And of course, it will come also from countries where the crisis is more under control, that they would provide more money now. But all this money can be needs to be very, very well distributed at this point. And it's just about writing priorities, priority setting, kind of, right?
Thank you, Pierina. Now, Christina, last 2 minutes, no pressure.
Yeah, thank you. Great question. I think the most important is to acknowledge the role of migration politics and border regimes as they're currently functioning in producing the vulnerabilities of migrants. So instead of seeing state and international actors as agents who are there to help or support populations who are already vulnerable, we need to acknowledge how they're actually implicated in producing those very economic and other forms of vulnerabilities that we see among migrants, and that are vulnerabilities that are sustained by the political system that is in place, and that can and maybe should be changed.
Thank you, Christina. Now it's last minute, so I think I'll just say thank you. First, both of you for joining our panel. It was a pleasure to work with you and to have a wonderful discussion. Although short, I would have gone for an hour more. And then I believe that we all can also say thank you to our audience with so much participation, so many interesting questions. And we try to answer them as much as possible. And hopefully there's no bad feelings about it. So thank you again for everyone for joining our webinar. We are hoping to see you again on our next webinar. And thank you again, Christina and Pierina, for joining the party.
Thank you. Thank you.
Have a wonderful day, everyone.